Hypertension in older adults, medication choices when constipation and falls matter. High blood pressure, also known as hypertension, is a very common health issue, especially as people get older. For older adults, keeping blood pressure well managed is vital for preventing serious problems with the heart and blood vessels, like stroke, heart attack, and heart failure. However, treating high blood pressure in seniors can be tricky. Doctors need to carefully balance bringing blood pressure down to a healthy level with minimizing unwanted side effects. This article will help you understand these complexities, especially when considering a common medication called amlodipine, and how it affects your body's muscles. Understanding amlodipine, how it works and its broader effects. Amlodipine is a widely used medication that belongs to a group called calcium channel blockers, CCBs. Think of it as a medicine that helps relax the tiny muscles in the walls of your blood vessels. When these muscles relax, your blood vessels get wider, a process called vasodilation. Wider blood vessels mean blood can flow more easily, which lowers the pressure inside them and, in turn, brings down your blood pressure. Amlodipine is very effective, especially for a type of high blood pressure common in older adults where only the top number, systolic pressure, when your heart beats, is too high, while the bottom number, diastolic pressure, when your heart rests, is normal or low. Another benefit of amlodipine is its long half-life, which means it stays in your body for a long time, so you only need to take it once a day. This can make it easier to remember your medication. However, it's important to know that while amlodipine is designed to relax the muscles in your blood vessels, its effects aren't always limited to just those areas. The same switches, calcium channels, that amlodipine affects in your blood vessels are also present in other smooth muscles throughout your body. Smooth muscles are types of muscles that you don't control consciously, like those that make your blood vessels widen or narrow, or help move food through your digestive system. When amlodipine affects these other muscles, it can lead to off-target effects or side effects. One common example of an off-target effect is constipation. Your digestive system has its own smooth muscles that gently squeeze, like waves, to move food and waste along. Medicines like amlodipine can relax these muscles too much, slowing down this movement, known as gut motility, which can lead to constipation. This is a common and often bothersome side effect, especially for older adults who might already be prone to constipation due to age, diet, or other medications they take. Beyond constipation, amlodipine's general relaxing effect on smooth muscles can contribute to other concerns in older individuals. Sudden drop in blood pressure and dizziness. While amlodipine helps lower blood pressure, an excessive drop, called exaggerated hypotension, can make you feel dizzy or lightheaded, especially when you stand up quickly. This increases the risk of falls, which can lead to serious injuries in older adults. Swelling in legs and ankles. Peripheral edema. You might notice swelling, most commonly in your ankles. This happens because amlodipine widens the tiny blood vessels in your legs. When these vessels are wider, a little more fluid can seep out into the surrounding tissues, causing swelling. Tailoring amlodipine treatment for older adults. Given these considerations, you might wonder if amlodipine is the right choice for seniors, especially since aging often brings general muscle weakness, a condition called sarcopenia. While amlodipine doesn't directly weaken your large skeletal muscles, its impact on smooth muscle function requires a careful approach. Older adults often have organs like the liver and kidneys that don't work as efficiently. This can mean medicines stay in your body for longer, slowing down drug clearance, and build up to higher amounts, drug levels, which might increase side effects. Despite these challenges, major clinical guidelines still recommend amlodipine as a first-line option for high blood pressure in older adults. The key is to have a personalized treatment plan. Your doctor will typically start with lower doses. For example, beginning with 2.5 milligrams daily instead of the usual 5 milligrams. This allows for gradual titration, meaning your doctor will slowly increase the dose until your blood pressure is well controlled or until side effects occur. Monitor closely. Regular checks for side effects like dizziness, swelling, and constipation are crucial. Consider other health conditions. The presence of other issues, such as chest pain, angina, where amlodipine offers an additional benefit, or heart failure, will influence medication choice. Review all medications. Many older adults take multiple drugs, polypharmacy. Your doctor will review all your medicines to make sure they work well together and don't cause problems when taken at the same time, drug interactions. Set individualized blood pressure targets. For very frail older adults or those with multiple health issues, a less aggressive blood pressure target might be appropriate to prioritize safety and quality of life over strict numerical goals. Other important first-line medications. While amlodipine is a valuable tool, other medications are also commonly used as first-line options. Thiazide-type diuretics. These are often called water pills because they help your body get rid of extra salt and water, which lowers blood pressure. They are very effective and well-studied, often considered a foundational choice due to strong evidence in preventing heart attacks, strokes, and heart failure. ACE inhibitors, ACEs, and angiotensin receptor blockers, ARBs. These work on a different system in your body that helps control blood pressure, often by relaxing blood vessels and reducing the amount of water and salt your body holds. They are excellent choices, especially if you also have conditions like chronic kidney disease, diabetes, or heart failure. Beta blockers for older adults. When are they used for high blood pressure? Despite their ability to lower blood pressure, beta blockers are generally not considered first-line medications for uncomplicated high blood pressure in older adults according to major clinical guidelines. This is due to several important reasons. Less effective at preventing major events. Many studies have shown that beta blockers, especially older types, are less effective than other first-line medications, like diuretics, ACE inhibitors, ARBs, and calcium channel blockers, at preventing major heart-related problems like stroke in older adults with uncomplicated high blood pressure. Higher risk of side effects. Older adults are more likely to experience side effects from beta blockers. These can include fatigue and tiredness. These can significantly affect your quality of life and physical activity. Slow heart rate, bradycardia, and sudden drop in blood pressure when standing, orthostatic hypotension. These can make you feel dizzy or lightheaded and increase your risk of falls. Effects on the brain and nervous system, such as insomnia, trouble sleeping, nightmares, or even contributing to symptoms of depression. Metabolic effects. Some beta blockers might make it harder for your body to manage sugar, glucose metabolism, and fats, lipid profiles. This is a consideration if you have conditions like diabetes or high cholesterol. Worsening existing conditions. They can make symptoms worse for people with conditions like asthma/COPD or severe circulation problems in the legs. When beta blockers are the right choice. Beta blockers are still very important and are indeed a first-line option when there's a compelling indication, even for older adults. A compelling indication means there's a very strong medical reason or another specific heart condition that makes a beta blocker the best choice for you. These specific situations include heart failure where the heart isn't pumping blood effectively, heart failure with reduced ejection fraction. After a heart attack. Chest pain, angina pectoris. Certain irregular heart rhythms, e.g., controlling heart rate in atrial fibrillation. When to consider beta blockers for a high resting heart rate. In some cases, a beta blocker might be considered for high blood pressure in an older adult specifically because of a consistently high heart rate, even if there isn't a primary heart condition like heart failure. A high resting heart rate in this context generally means a heart rate consistently above 80 beats per minute, BPM, when you're resting. This threshold is important because a persistently high resting heart rate above 80 BPM has been identified as an independent risk factor for heart problems, even in people with high blood pressure who don't have obvious heart disease. It can signal that your body's fight or flight system, sympathetic nervous system, is overly active, which beta blockers can specifically help calm down. Recent medical guidelines support considering beta blockers to start blood pressure treatment in patients with a resting heart rate greater than 80 BPM, recognizing the benefit of addressing this specific risk. Medication choices for seniors with bowel and urinary concerns. For older adults with high blood pressure who also experience significant bowel issues like severe constipation or fecal impaction, or have urinary difficulties, choosing the right first-line blood pressure medication requires even more careful thought to avoid making these conditions worse. Fecal impaction, a critical concern. Fecal impaction is a very severe form of prolonged, untreated constipation where a hardened mass of stool gets stuck and blocks the rectum or lower colon. This condition is common in older adults and can lead to serious problems like a blocked bowel if not addressed. Its presence means it's crucial to avoid any medication that could slow down gut movement. Medications to be cautious about, or avoid. Calcium channel blockers, CCBs, like amlodipine. As discussed earlier, these medicines relax smooth muscles, including those in the digestive system. This can significantly slow down gut movement and directly worsen existing constipation, or critically, contribute to or make fecal impaction worse. Therefore, CCBs would generally be strongly avoided as a first-line option for older patients with severe constipation or a history of fecal impaction. Some beta blockers, while they don't directly slow gut movement as much as CCBs, some beta blockers can still indirectly contribute to constipation. In patients who already have severe constipation or fecal impaction, or significant urinary difficulties, this potential side effect means doctors need to be cautious and monitor closely. Diuretics, water pills, while often effective, diuretics can indirectly worsen constipation if you don't drink enough fluids, leading to dehydration. In older patients already prone to severe constipation or fecal impaction, this indirect risk is a real concern because dehydration makes stools harder. Additionally, the increased urine volume and frequency caused by diuretics can worsen feelings of needing to urinate urgently, needing to urinate at night, nocturia, and potentially symptoms of an enlarged prostate, BPH, in men, which can increase fall risk and affect quality of life. Preferred first-line medications for seniors with bowel and/or urinary concerns. When considering severe constipation, fecal impaction, or urinary difficulties, angiotensin receptor blockers, ARBs, such as losartan, and ACE inhibitors, ACEs, stand out as particularly favorable first-line choices. Angiotensin receptor blockers, ARBs, e.g., losartan. Minimal GI/urinary impact. ARBs generally have a very low chance of causing or worsening constipation, and they don't directly affect gut movement in a negative way. Crucially, they also do not increase urine volume or frequency, making them much more suitable for older patients who already have bladder issues, like frequent night urination or urgency. Effectiveness and benefits. Losartan and other ARBs are highly effective at lowering blood pressure and protect your heart and blood vessels. They are excellent alternatives for patients who cannot tolerate ACEs, for example, due to a persistent cough. Better tolerability. Compared to ACEs, ARBs often have fewer side effects, mainly because they cause much less dry cough and have a reduced risk of a serious swelling reaction. This often makes ARBs a practical preferred choice in general practice due leading to better patient comfort and adherence. ACE inhibitors, ACEs, e.g., lisinopril, and enalapril. Minimal GI/urinary impact, similar to ARBs, ACEs typically do not affect gut movement in a way that causes or worsens constipation. They also do not increase urine output, making them suitable for patients with urination difficulties. Effectiveness and benefits. ACEs are highly effective, well-studied, and particularly beneficial for patients with other conditions like chronic kidney disease, diabetes, or heart failure. While generally effective and well-tolerated, the risk of cough and swelling reactions means ARBs are often the preferred alternative if these side effects occur. Conclusion. In summary, there isn't one single, best, medication for all older adults with high blood pressure. While amlodipine is effective and often recommended, its broad effects on smooth muscles mean doctors must carefully consider its potential for side effects like constipation and dizziness. Beta blockers are vital for specific heart conditions like heart failure, but generally aren't the first choice for uncomplicated high blood pressure in seniors due to their comparative effectiveness and safety profiles. However, a consistently high resting heart rate, above 80 bpm, can be a specific reason for their use. For older patients dealing with severe constipation, fecal impaction, or significant urination difficulties, ACE inhibitors and angiotensin receptor blockers, like losartan, are especially strong first-line recommendations because they have minimal impact on these critical patient concerns. The best treatment plan for an older adult with high blood pressure is always a personalized one. Balancing how well the medication works with how well it's tolerated, and taking into account each person's unique health situation.